Hello and welcome to our webinar today on supporting pupil wellbeing from a strategic position. My name's Hannah Stolten. I'm the Chief Executive here at Governors for Schools, and it's a pleasure to welcome our panellists joining us today to discuss this really important issue. Hopefully you've always been our Wellbeing Governors campaign and made the most of the resources that we've been sharing so far. This session will be looking at how we really focus on pupil wellbeing, as I said, from a strategic position, which is always a challenge in this very important area. So today we have with us Kaley Foran. Kaley is the lead content editor at The Key, both for school leaders and school governors. She has a wealth of knowledge about everything school governance and is going to give us some key insights into what steps governors can take to ensure they're supporting the school in this area. Following Kaley's overview, we'll be opening up the conversation with our wonderful panel of speakers. We've got Kelly Hannaghan. Kelly is a wellbeing consultant and author. She's also a former school wellbeing lead and she served time as a governor, so some really valuable insights from her coming. John Midgley is a governor. He has been a governor for 20 years, so very experienced, and is currently chair of governors of Bradley's both community and primary school in North Yorkshire. So lovely to hear from you from North Yorkshire, John, and hear about how you've done wellbeing initiatives in your schools. And finally, we have Ruth. Ruth is a leadership coach specialising in education. So Ruth Pearson, leadership coach specialising in education. Ruth is a secondary school teacher sitting on senior leadership teams, and she's also the founder of Listening to Your Voice. So lots of contributions from her. You may have seen in the promotion of our event that we were due to have Nikki Hall and Nikki Caulfield joining us from Kingmore Infant and Nursery School in Carlisle. We'd asked them to speak because Kingmore has been awarded the Exceed Award, which is an accreditation recognising whole school commitment to mental health and wellbeing. Unfortunately, they're unable to join us today. They've have some teachers isolating due to COVID and need to cover classes. I think we can all relate to those challenges right at this moment. So we're hoping to record an interview with them in the future, and we'll be able to share that with you so that you don't miss out on any information that they were going to share. So before I hand over to Kaley, if you do have any questions for our panellists as we go along, put those into the chat at any time during the session. Then when we're ready, then we can ask them of each individual panelist. So I'll hand over to Kaley now. If you can start us off, Kaley.
Sorry, I had myself muted. You'd think I'd be used to doing this by now, but but apparently not. Can I just check that everyone can see the blue slide that says supporting pupil wellbeing, what governors can do, before I crack
it's
on?
Not maximised for me, Kaley.
I apologise. Let me just. There we go.
There we go.
There we go. I apologise. Sorry about that. We got there in the end. We got there. Thank you very much to Governors for Schools for having me. As Hannah very kindly mentioned, I specialise in leadership and governance at The Key, and I'm going to talk to you a little bit about what governors can do practically to support pupil well-being while maintaining that strategic focus. I know how difficult that can sometimes be. Well-being is, of course, a really massive topic, and it really does touch every aspect of school life, and that can feel really overwhelming. So rather than talk about all of the possible things that you could be doing, I'm going to recommend a few key focuses that are really worth your attention right now, and those you can see listed. Those are kind of safeguarding, focusing on well-being in the curriculum, support for key groups of pupils, and then a focus on training and support for your staff. These are particularly relevant right now in the context of COVID-19 and lockdown, but they're also just really relevant more generally. So a focus on these things now will help pay dividends later in terms of supporting your pupil well-being in your school going forward. So it might feel a little bit obvious, but safeguarding is a necessary first focus when we think about well-being. Safeguarding becomes much more of a concern during lockdown, and has become, during when schools were closed at the end of the last academic year. But even if your school remains open, and and just more generally when things are back to some form of normal, it's really important that as a first well-being focus, your school is keeping pupils safe, both when they're on the school premises and when they're at home, or whether that's just generally, or if they're in a period of quarantine or self-isolation. We know that during lockdown, self-isolation, in this COVID period more generally, there have been certain safeguarding concerns that have become more prevalent, and those include kind of increased incidences of domestic violence and abuse, greater food insecurity, and then there's obviously the risks that come with people spending more time online. Your school's first job, and so your first job as governors, is to make sure that pupils are safe and well. So how do you go about doing that? You should already be receiving regular reports from your head teacher and your designated safeguarding lead about safeguarding in your school, and that should include top-level information about the number and type of safeguarding concerns. If you are a safeguarding link governor, the type of information that you'll get, or the amount of information that you'll get, will be different to than if you're just sort of sitting on a committee more generally, or on your board more generally. But make sure you're asking whether you're a kind of designated safeguarding governor, or just, or anyone else really. You should make sure that you're asking the right questions about how your school is making sure pupils are safe, both in school and at home, and how your pupils are being kept safe online. If you're not already hearing about mental health patterns and well-being patterns and concerns as part of this information, you should make sure that you ask for it, because mental health support and well-being support is part of safeguarding a pupil. So if you're not sure whether that's included, or how much of that your school is seeing, you should absolutely make sure that you ask for that information as part of the regular reports that you get. Another practical step that your board can take, particularly now, is making sure that your designated safeguarding lead has the support that they need. This is obviously true all the time, but because of the really intense focus on pupil well-being at the moment, there's a lot going on that's new or different, or even just more in volume for your designated safeguarding lead. So making sure that they have the support they need is really critical, and it's something really practical that your board can do. That support might take the form of more regular meetings with your safeguarding link governor. You could be able to access support from your local authority or your academy trust, or even from other local schools who have dealt with patterns of safeguarding or well-being challenges that are similar to what your school is seeing. But even just being a listening ear can be really helpful. Being a designated safeguarding lead and being on the receiving end of a lot of pupil well-being challenges can be really emotionally draining, and it can be a really difficult and isolating role. And so being there for your designated safeguarding lead as an emotional support, and to have some, a listening ear to have some of those conversations, might feel a little bit fluffy, but it's really critical and a super practical thing that your board can do. Having those regular conversations also provides a space where you can have conversations about the barriers that might exist to your safeguarding lead getting the support they need, or indeed, as I'll come on to in just a moment, kind of wider training that your staff might need. So for instance, you may, through those conversations, learn that the training budget is quite tight. Your designated safeguarding lead feels like they don't have this, the training that they need to have the right kinds of conversations, or really supportive conversations with pupils about their well-being. And if that's true, there are conversations that your board can have about the way that you're using your budget. And those are really practical things you can take forward. Moving on from safeguarding, your school's curriculum is one of the key ways that it embeds support for pupil well-being. Much of this will come through your school's PSHE, that's personal, social, and health education, and relationships and sex education provisions or kind of schemes of work. These curriculum frameworks include focuses on both mental and physical health. But also from a well-being perspective, those curriculums help pupils to build understanding of healthy friendships and relationships. And that's really critical to everyone's well-being, whether you're a pupil, staff, or anybody else. And it talks to pupils about safety, both in real life and online. So this is a really critical stream of well-being work that runs through your school's curriculum. But PSHE and RSE shouldn't be bolt-ons. You shouldn't just expect to see them tacked on for a couple of days, a term, onto the end of your curriculum. They should be integrated to the wider curriculum. That kind of consistency, that embedded approach is really what helps to build a whole school approach to well-being. So for instance, there are really clear well-being links that can be made in subjects like PE or English and literacy. The list really is, that's not an exhaustive list. It really is almost every subject. And so it's really an integrated approach that you should be looking for. As governors, the most important step that you can take is making sure that you're having the right conversations about your curriculum and how well-being is embedded within it. As I mentioned, you should be looking for things to be kind of integrated throughout rather than treated as a bolt-on. And you should be asking questions about the quality of resources that the school is using, how well the scheme of work that you're using reflects the challenges that school leaders regularly see in pupils, and how well equipped teachers feel to deliver PSHE and RSE material. If your school uses subject-specific curriculum policies and your governing board reviews these, even if you don't approve them in a formal way, but they kind of come through you, it can be good to have these conversations at that point that you're reviewing these policies, because that's where you would probably expect to see some level of detail about how cross-curricular links are created, how teachers are provided with training and support, etc. Once you've had all of those conversations or you've looked at a policy, a key role for you is making sure that the school follows up, essentially. And that could mean adding actions related to well-being into curriculum-focused items on your school improvement plan or your self-evaluation form. Doing that and kind of making sure you're getting things down on writing, in writing, on action plans, in lists, it helps create a good monitoring structure so that relevant committees or link governors have something to follow up on. And it will also make sure that you've got essentially a list of regular updates that you need from your school leaders, and it can really help you follow up on some of those well-being conversations that you're having. So it's worth taking some time to talk about a few key groups from a well-being perspective, because these are the groups of people where pupils where well-being is likely to be a more acute concern right now in a COVID context, and where remote learning is likely to pose more of a challenge. We're talking in particular about pupils with special educational needs and disabilities, pupils who speak English as an additional language, and pupils who come from disadvantaged homes. So your pupils who are eligible for the pupil premium in some form, either through eligibility for free school meals or because they are looked after, post-looked after, or from military families. In your school, there may be other key groups, so it's worth talking to your school leaders about who those groups are. So for instance, in your school, that might be white working class boys or gypsy and traveler pupils. In the school where I'm a governor, there's more kind of acute well-being concerns around our kind of Turkish boys. And so it does depend on your school's context, and it's worth having those conversations. But almost regardless of school context, your pupils with SEND, EAL, and your disadvantaged pupils will be worthy of your attention at the moment. Pupils in these groups are most likely to have developed significant gaps in their learning as a result of school closure in the last academic year, which in itself can be a well-being challenge. I know it sounds like we're talking about an academic challenge here, but if you have significant gaps in your learning and you're falling behind your peers or feeling like you can't keep up, that in itself is a well-being challenge that the teachers will be really alert to. But these are also the groups of pupils who are most likely to need additional support with remote learning, or who will struggle to access remote learning. So for instance, due to lack of technology at home, or parents who don't feel confident enough in their English to support their pupil in home, or their child with their home learning, or indeed in the case of pupils with SEND who may need accessibility adaptations in order for them to access remote materials or video or whatever it might be. There are a couple of key things that you can do as governors to support the well-being of these groups right now. And as I mentioned, that the work that you put in now will help to carry through, the rest of, the rest of the year and onwards. The first is to make sure you're getting regular updates about key groups of pupils, both academically and pastorally. We tend, as governors, because sometimes those academic, those progress numbers or those attainment numbers are attached to specific groups of pupils. It's easy to think about attainment in a group specific way, but to kind of forget about pastoral challenges in that same group specific way. And it's worth making sure you're applying that lens both to well-being and pastoral challenges as well as your academic results. Check with school leaders about how these pupils are being supported with remote learning or will be supported should that become an issue. This might be in your remote learning contingency plan, or it might be set out in individual lesson plans, but make sure that your school leaders have a plan of attack, as it were, for those key groups. You don't necessarily, as a governor, need to review these documents or understand the plans in detail, but you should know in broad strokes what your school is planning to do and be informed enough to have follow-up conversations about this regularly, particularly if cohorts of pupils within your school need to self-isolate or kind of access that remote learning. And then finally, talk to your school leaders about how the school can best support parents and pupils in these groups. Supporting parents in turn supports children, and there are some limitations here, as we all know, due to the way that schools are running as a result of COVID. So you might not be having coffee mornings as you normally do. You might not be seeing as many. There might not be as many kind of at the school gates conversations happening between class teachers and parents. But there are ways for you as governors to get the information you need. For instance, a couple of well-targeted questions about pupil well-being or specific challenges at home within an annual pupil survey can be really useful, or even just a couple of focus groups, or if your senior leaders are still having virtual coffee mornings, dropping into some of those, just so that you can get a picture of the kinds of challenges and that your parents are facing, so that you can then in turn have conversations with your school leaders about what you can do to support. And last but not least, before I kind of round up, one of the most fundamental things your school can do to support pupil well-being is make sure that staff are prepared and supported, both in terms of delivering the curriculum and more generally. Talking about well-being with pupils or supporting pupils with well-being challenges can be really tricky and sensitive. I mean, think about how delicate conversations around mental health, bereavement, stress, and friendships can be. So as governors, you've got a really critical role to play in helping to make sure that staff get the training that they need. If you're on a personnel committee or similar, you can make sure that you make time to review your school's training record and discuss how the training that staff are undertaking lines up with well-being challenges in much the same way that you would do with anything else. When your school sets its school improvement plan for a year or 2 years or however you go about doing it, you would then expect the training that staff are provided to line up with school improvement priorities. This is the same. You should be looking to make sure that well-being features here. If you don't see training targeted at well-being or supporting pupils with specific well-being challenges, really press on why that is. That training, as I alluded to before, doesn't have to necessarily be a course. It could be working closely with another local school who has more experience of supporting pupils who have, for example, recently left care and, the pastoral support that those pupils need. So it doesn't have to be courses necessarily, but you should have those conversations about what support and additional training is happening. It can often feel like there are too many training priorities and not enough time or budget, and I definitely appreciate that that's difficult, but talk to school leaders about the barriers to effective training and what you as a governor can do to help. All of what we've discussed I've just discussed or run through can feel a little bit woolly and like you're not practically doing much other than talking and having conversations. And this is just, this is a challenge in governance forever, right? So I think it's worth remembering what it means for governors to take practical steps when we talk about governors doing something. You won't be able to take a single action that will directly impact pupil well-being, but you will be able to have a strategic impact by making this a focus within your schools. And you'll do that by driving a holistic approach to well-being. Just saying, let's write a pupil well-being policy is not really going to do the trick, because that policy has to lean on initiatives that are embedded throughout the school, through safeguarding, through curriculum, through staff training, through kind of a pastoral focus on key groups of pupils. And that's what the policy would reflect. That a policy doesn't do that job for you. And that all means kind of making sure that key conversations around the topics that we've just discussed, and indeed every other aspect of school management and leadership, includes some acknowledgement of pupil well-being. And so as you review policies, you'll apply the same well-being lens that you might have done for staff workload. Many of you may remember that a couple of years ago there was a big focus on staff workload from the Department for Education, and a lot of guidance pushed out to schools on how they can take ownership of this, that included applying a well-being lens to every single policy and procedure that your school has. I would suggest a similar approach here from governors. Every time a policy lands with you for review, what are the implications on pupil well-being here? How do we see pupil well-being reflected? There will be obviously exceptions to this. There's not a lot that a staff grievance policy has to do with pupil well-being, but I think if it's curriculum related or could have a pastoral impact, it's really about thinking that through. And if you kind of add it as an item to ask about in every conversation, in every policy review, then you'll sort of gently nudge school leaders into a more holistic approach than just, oh, well, we have an action plan and it's got a few things on it. It has to be more embedded than that. And then you'll also make sure that your school has the resources that it needs to execute on well-being priorities. And some of that will be making some really difficult decisions and trade-offs about what is a priority right now and what isn't. This is always a challenge for schools, and it can feel really overwhelming that you've got pupil well-being challenges, staff workload and well-being challenges. You have the challenges of helping pupils catch up on lost learning as a result of lockdown. There's the list can always feel endless, but as governors, you have the real, you're in a position to help school leaders focus their attentions on the 2 or 3 things that are really most critical, and then making sure that everything your school does aligns with that. We've decided that pupil well-being is our most critical focus this year, so our budget is going to be reviewed with pupil well-being in mind. Our staff training priorities are going to be reviewed with pupil well-being in mind. Our curriculum is going to be reviewed with pupil well-being in mind, and making sure all of those threads kind of line up so that, when you see, if you were to see it written down on your SEF, you would see pupil well-being repeated in every single item, every single action. And so that's where, as governors, you can really drive that strategic impact and help your school kind of achieve a realistic, holistic approach to pupil well-being. There's obviously lots more to pupil well-being, and this is just a whistle-stop tour and a few early things to think about. But I think we've got time to take some questions if anyone has any.
Thanks ever so much, Kaley. Yes, we do have lots of questions coming through. one that I've got is actually related to the training that you were talking about. What CPD can we recommend for our teachers? Is there anything that's free and due to the budget constraints at the moment that you would recommend?
That's a really good question. I will slightly shamelessly flag that the Key has a product called Safeguarding Training Center, which includes some mental health and well-being support guidance for designated safeguarding leads and school staff. But actually, I think in terms of free resources, I think what's really actually potentially most useful, and this is what we hear from school leaders most often, is reaching out to the wider school community, be that within a trust or a local authority, and talking to schools about the well-being challenges they're seeing and what's worked for them. You know, actually the hardest thing about well-being and supporting pupil well-being is just how individualized and personal it can be. It's really hard to say, well, I mean, I think, you know, we've all been in a corporate environment where where someone says, oh, we really care about your well-being, so we're going to give everyone free yoga every week. It's like, well, that's nice, but I don't need yoga. I've got 3 kids at home and I don't have time for yoga. Like, it has to be personalized and individual, and that's true of pupils as well. And it's really context specific. So really encouraging your school leaders to talk to other school leaders about the well-being challenges they see, what they've tried, what's worked, what hasn't, why. That's the best free CPD there is, really, I'd say.
Brilliant, thank you. I will also mention on the free training front, we've been working with Place to Be on our Wellbeing Governors campaign, and they've got a mental health champions programme, which is free to all qualified teachers who are based in the UK. So that's available on the Place to Be website if you would like to access that. Another question that we have is there a definition of well-being for the school context?
No, not officially. I think this is where it's really important to talk to your school leaders about what challenges in particular they're seeing. So the school where I'm a governor, at one point in time, we had a significant minority of pupils who really struggled with attachment issues. And so well-being for us was often focused on, was focused first on that. That was our biggest challenge. But then there were other kind of context specific things related to who our pupils were, basically. And I think it really does depend, but I think what we can say is that pretty much all definitions of well-being include just being physically safe and well, and being mentally well, as much as possible, and having those mental health supports as well. So additional well-being challenges are going to be context specific, but it always includes safeguarding and mental health.
Lovely, thank you. We'll do one more question before we hear from Kaley. How much more regularly should governors be interacting with the designated safeguarding lead, given the constraints on face-to-face meetings at the moment?
That's a really good question. So we would recommend that you should be meeting with your designated safeguarding lead, or that your safeguarding link governor should be meeting with your designated safeguarding lead at least half-termly. That's what we would recommend. And that's primarily because there are so many facets to what safeguarding includes that it's almost impossible to fit it all in in any other way. I think about half-termly is probably right. I think rather than thinking about more face-to-face time, and I'm simply recommending this from a DSL workload perspective, think about what you could get from your DSL in a written report or a written note, and what actually needs to be a conversation. So, and this is going to be about what the safeguarding priorities are in your school, and the well-being priorities are in your school, and what kind of trends you're seeing in safeguarding and well-being kind of incidents or concerns. But for instance, if attendance and the risk of children missing education is really low in your school, but that's a regular agenda item for you to talk about with your DSL, is that something that you could ask your DSL to create a couple of paragraphs of written summary about and send that through first, so that you can save your face-to-face time for those most critical conversations? That would be my recommendation.
Brilliant. Thanks ever so much, Kaley. That was really, really interesting.
My pleasure.
I'm sure we have got a whole host of other questions, but I think some of them are probably more relevant for the other speakers. So I'm going to hand over to Kelly now. If you're good to go, Kelly. I can't hear you. Hello?
You can hear me now.
Perfect. Thank you.
Okay, I'm hoping that you can share my screen. Can you see my screen okay? Brilliant, thank you. So hello and welcome to today's Governor for Schools session, and thank you to Kaley for that really insightful session. I've taken lots of notes that I'm going to embed into my continued practices for embedding whole school approaches for wellbeing and mental health within schools. So my name is Kaley Hannaghan. I'm a mental health and wellbeing consultant, and I work for the education people, but I also do lots of freelance work through my business Mindwork Matters Limited. I'm absolutely delighted to be invited here today to talk about my most favourite subject, which is wellbeing in education. So a little bit more about me. I've worked with many schools and settings to help build purposeful strategies for wellbeing and mental health in schools to help pupils, staff, families and the local community to flourish, especially from adversity. And there is no time better than to have this powerful conversation. We understand the crisis that we currently sit in within education, and that crisis has been escalated due to the coronavirus pandemic. And I firstly want to start by thanking you as school governors for continuing to support your school leaders in ensuring that their schools and settings are a safe space that offer an irresistible invitation for learning, along with providing that social scaffolding that supports the well-being and mental health of pupils, families and staff. My work has received many acknowledgements and awards, one being I was recognised with my work for wellbeing in education from the Department for Education. I've also had my work acknowledged from the Education Support Partnership, which is the only leading charity that supports the wellbeing of staff and all educators within education, and I'm going to talk a little bit more about them later. I've done lots of work and writing and blogging for charities such as the Anna Freud Centre, and my work has also been commended from the National Children's Bureau. I would say the biggest highlight of my career was when I had the opportunity to present to the Duchess of Cambridge at the Royal Foundation Mental Health Conference. But I always say, so what? Because the biggest achievement that I've ever succeeded in my whole career is to see the difference that my work with others makes to the lives of the pupils and families who walk through school gates every day. We give the best opportunities for the most flourishing outcomes, and that is the best award that I can talk about today. So my purpose is to be a force for change, to help support schools and settings to embed purposeful strategies that are sustainable for wellbeing and mental health. So you might be thinking as school governors, how can we help our senior leaders develop these strategic approaches? And I want to start by reminding you that you have the power to create long-standing change. And I know this to be true because I've worked as a school governor within a school setting, and I was originally invited in because the school was in special measures, and they were in a really desperate place. The relationships were broken down between parents and the school. There was a missed sense of trust there. Students were not attaining because they wasn't engaged with the learning. The well-being of staff was at an ultimate low, and relationships were broken. So I was brought into a school as part of a school improvement plan, and if you want to check out my work, that school was Lesness Heath Primary School, and it was part of the Primary First Trust. And the first thing that I did was understand quite clearly that I needed to have governors on board. They were an important part of that process. They had the power to be able to ask them challenging questions to school leaders to think about how well-being was threaded through every part of the school community. So I invited my school governors to be able to come and explore the possibility of what the outcome could look like if well-being was put first, because I know it to be true, and I have the evidence and data to show that if you look after the well-being of young people, it literally looks after the learning. And I now can celebrate data that shows that when you put a foundation of support for wellbeing and mental health, the attainment level rises, the attendance of students is greater, the positive impact of parent engagement grows in the sense of the relationship and trust and the commitment for families, having that alignment of communication that's a consistent language that's used both with the home and within the school setting. And if you are a school that looks after your staff, you hold on to your staff. And if we think about the current crises around protecting teacher retention and safeguarding our newly qualified teachers' careers, it can be quite simply career changing to embed wellbeing into schools. So the first step, and the thing that you can start to think about today, and you may already be doing this within your roles, and I commend you for that, but if you are on the starting point of your journey, that's okay too, because we all need to start somewhere. So the first step of that is to undertake high quality mental health training yourself, to understand all the layers of mental health needs, to connect with the knowledge of knowing that it's not just about doing that immediate urgent help work within schools, but it's also thinking about them preventative measures and asking questions to your school leaders. What are they doing to prevent well-being, depleting well-being turning into a mental health illness? And then thinking about having a voice on a vision statement. So do your schools and settings have vision statements that are closely aligned and embedded into your school development plans? And the most simple vision statements are the ones that anyone within the school community can recite. They have purpose and they have meaning. So my vision statement within many schools that I've supported is to put well-being at the heart of their school. And what this looks like is that well-being is threaded through every part of the school fabric. It's embedded within the school context, but also that learning and that enrichment of knowledge is shared within the local community and in the wider context. I really do believe that the important step in this process is to support school leaders at this time. We understand the tremendous stress that they're under in order to keep their schools safe and to offer that learning around emotional health, also coupled with possibly the rising need for mental health issues, not just from the pupils, but also thinking about there may be needs for staff and also family, and these have an impact on the outcomes for our young people. I think it's really valuable to recognise that if you are supporting that process and walking with your school leaders, or possibly even your pastoral leaders or wellbeing leaders, to be part in building that strategy and to ensuring that that's discussed at your full governor meetings, and asking questions and having regular monitoring visits where you understand, just like Kaley was saying, that every decision that's made has a thought process and a lens that looks at the aspects of well-being for all stakeholders within the school community. Part of the process of the work that I've done and have done in many schools is to build change teams within schools. So these are an invited space where staff, parents and school governors and even the local community, so I invited the local police, behaviour support, and I looked within the local authority to bring people together who wanted to be a force for change, and we would meet once a month and discuss how we can create these plans. And part of that was to look at what the strengths and weaknesses and opportunities and threats were within the school context, and thinking about ways to build in purposeful intervention that was monitored regularly and evaluated, because there's no point just ticking a box for wellbeing. We know it's part of the Ofsted requirements. We know that there has been some real deep thinking around the impact of that poor mental health and wellbeing has on the life outcomes of our future generations. So I think it's really vital to recognise the importance of really clearly looking at the steps to success and thinking about how you support your staff in that process, and asking what you can do right now, going to your school leaders and asking them what they need from you in order to carry on doing that amazing job they're doing, because we know that so often school leaders are an act of service and they are supporting the well-being of others when they are running on empty themselves. It's a bit like the analogy of not putting on the oxygen mask on someone else before on ourselves, but so often school leaders are running from a space of empty, and I really do believe you can't pour from an empty cup and serve a diet of well-being to others when your own diet is malnourished. I'm just going to move on through my presentation now. This is how governors can monitor the impact of mental health and wellbeing. And I was really grateful for our chair of governors who supported me. I was a staff governor and they would come in, they helped me build the strategy for wellbeing. We collaboratively created the vision statement, and then we looked at planning in regular visits that they would come into school to have that focus of wellbeing, to seeing it in action within the school community, but also avoiding those pinch points within the year. It's really important not to add to the workload that teachers are currently facing, and then to look at the purposeful evaluation processes. I really do believe there's no point in offering stakeholder evaluations, and when I talk about stakeholders, I'm talking about the parents, the staff and the pupils. If you ask for their voice and what they need or their experiences of your wellbeing offer within your school, you need to feed that information back with action for change, because otherwise what we're doing is we're creating even more work where there's no positive outcome. And then thinking about helping create the policies, like Kaley was saying earlier, you need to ensure that there is a thread of wellbeing through all of them policies. And then thinking about completing a SWOT analysis, looking at the strengths, weaknesses, opportunities and threats, but also looking and exploring a provision matrix. What do your schools currently offer to support the early help, the prevention and the immediate care for wellbeing and mental health within your settings? And then look at the strengths within the school and celebrate these strengths and feed it back to the school communities. I'm hearing from many educators who are not experiencing that space of affirmation. They're missing that sense of connectedness in schools. They're stuck in their bubbles in a space where they're not able to connect with people like they were before March. And I think it's really important to, as school governors, to think of creative ways with school leaders to bring communities together in a safe and meaningful way. And then I think it's really vital to explore what the engagement and expectations are within the school. What do you expect from me as a school governor? What do I expect to see in the outcomes and the interventions and the curriculum that you're offering for our young people within education? So my next point is to think about how can you evaluate your own effectiveness in supporting pupil mental health and wellbeing, collecting feedback in many forms. Again, like Kaley was saying, using creative ways to collect that feedback. I had lots of focus groups that I was working with, and many parents, as the relationship started to grow and trust started to build, they would volunteer themselves to come in and speak to governors. And I know this maybe needs to be done in a socially distanced manner, maybe virtually, but the power of voice has a real impact in understanding what the experience is like of the people who come to school. Parents trust you as teachers and as governors to support and look after their children. So when you're hearing what their return thoughts are on the offering that you're offering their students, it can be really, really empowering, and also builds on positive relationships. And then looking at building mental health and wellbeing networks, not just within your school community, but looking in the wider context. So how can you bring people in to help you? And there are social media platforms that can really help with that. I've gained lots of experience and opportunities through platforms such as Twitter, and LinkedIn. So asking for help if you need it, and then also connecting with local, with national services such as the Anna Freud Centre, the National Children's Bureau, Young Minds and Place to Be. They all have a wide range of resources, free resources that can support your schools. With many schools that I've worked in, we haven't had a budget for wellbeing. The wellbeing budget has been spent on me being in the school and finding innovative ways to help support schools without dipping and taking large amounts of funds from much needed budgets within schools. So thinking about, do you have a knowledge of the local offer for staff wellbeing and pupil wellbeing, and the well-being of parents and the wider community within your local areas, within your schools? And that could be a starting point for you to start to build up this information and ask questions to the staff. Do they know how to get help and how to recognise and understand what depleting mental health and well-being looks like in their pupils? And then, have you explored the Ofsted requirements? I'm sure you have, but really digging deep and looking at the finer details around requirements for the PSHE. That was supposed to be happening in September this year, but it's now, there's been given an extension due to the impact of the pandemic. And I think the most vital component and the best offer that you can offer school leaders at the moment is a listening ear, having a space to listen, to understand. So thinking about the questions that you can ask your schools at the moment to understand what is happening in terms of supporting wellbeing. One of the questions you can ask is your school a listening school? How aware are they of the school community, aware of promoting good, positive mental health and well-being? Does your school have a mental health policy for pupils and for staff? And what is the quality of them policies? Is mental health part of the curriculum? Have staff been trained to recognise and respond to mental health needs? And do staff know who to refer to if they have mental health concerns for pupils? And has your schools usefully pooled their knowledge of local support and national support services? And has your schools considered how best to work with parents in the wider community? I have worked with many parents and set up lots of groups, including a group that I created, a programme of support called the Family Matters Group. It started off in one school with 4 parents and ended up with 400 parents who engaged with the programme, and the results were quite simply outstanding. We had families coming off long-term safeguarding plans. We had parents who were seeking work opportunities and securing job placements, parents who were going to college. It was quite amazing the work that I've done within schools, because it's really hard to measure well-being, but you just have to walk into a school and see how inviting it is, and see how happy the students are, and seeing and understanding how the staff choose to stay in that school because they feel happy. If you need any support or resources, you can connect with me at the Education People. I have 2 upcoming sessions available. One is a mindfulness.
Kelly, could we share those afterwards? I'm just aware that we're running out of time, so yes, we'll share these slides across so everyone can access those afterwards, and we'll hand straight over to John to talk us through his role as governor. Thank you so much, Kelly. Lots of information.
Hi, thanks, Hannah. As Hannah said earlier, I'm John Midgley. I'm a chair of governors of a rural primary school in North Yorkshire. If you think there's a technical fault because you can't see any slides, there isn't a technical fault. I haven't got any slides, so you'll just have to listen to me. About 3 or 4 years ago, we were looking at introducing a sort of more values-based education for our children, and this causes, I suppose, to carry out a review of our values and our ethos. As part of this, we started looking at mental health and well-being, I suppose, quite a bit before anybody else was looking at it, and it was a bit fortuitous. At about the same time, the government provided funding to some local authorities to support well-being and mental health, and we were lucky that a charity called Compass Buzz was funded by North Yorkshire to provide some input and training. And the reason we took the strategic step to look at to sort of try and embed well-being and mental health into everything we did was, I suppose, because For many years, we'd been a school putting care and nurture at the forefront of everything we did. And this led, amongst other things, to children coming to us from other schools where perhaps they'd had issues or difficulties or they weren't happy. And we felt there was a need for sort of a more holistic transition, both for the individual concerned and for the group they were joining. Secondly, we recognised, I think like everybody else in education, that there was a growing number of children who, whilst not fitting into a formal definition of presenting special needs, certainly had additional needs, which a wellbeing and mental health agenda would help us to respond to. And I think also we recognise more and more children coming to school with an increasing amount of home and family-based emotional baggage and disadvantages. So when we started looking at this, what were the key issues? Well, I would say that the top of the list was getting everybody concerned to understand the link between mental health and achievement. When you've been talking about mental health and involved with wellbeing over a number of years, it's pretty obvious. But when you start doing this, it's fairly difficult to get some people to accept the link. We realised very early on that mental health and wellbeing need to be core to the whole school ethos. You know, it needs to be embedded in everything you do, and it needs to be valued by all stakeholders. It's not the sort of thing that you can pay lip service to, because it's clear that, you know, happy children learn better. We agreed early on, after it was a lot of debate, but that mental health and wellbeing needs to have an equal standing alongside academic success and standards. It's really important for our school to see that we can't just educate children to pass SATs tests in maths, reading and writing, that actually mental health and wellbeing crosses everything, and also it involves and embraces and engages those children who might not be particularly academically bright. You certainly need access to quality training for staff. I mean, we were very lucky in using Compass Buzz. It's a charity, it only operates in this area, it doesn't operate across the country, but you know, their website's particularly useful if you want some more information. One of the other key issues was accepting and realising and understanding that everybody's mental health and everybody's well-being is equally important. It's not just about children, not just about staff, it's also about governors. And in the early stages, we got some training for our governors as well as our staff. You need to accept that you've got to designate funding to support any initiative. And you've got to, I mean, perhaps one of the most difficult things to tackle was agreeing a strategy to deliver wellbeing and mental health within what was an already really full and very busy school day. So sort of what were the challenges? Well, one of the big challenges was encouraging openness and getting people to talk about mental health and well-being. It's not a thing that a lot of people want to talk about, even amongst the teaching community or the governing community, and certainly not amongst the parent community. But we found that by just continually opening up and talking about mental health and well-being and the way we felt that it could affect our children's outcomes, eventually we got more and more people engaged in what we were doing. We had to revisit our school ethos and our values and engage with all the stakeholders. It fitted in very well from the parents' point of view in the fact that we were moving on to sort of a values-based education. So we sort of crept mental health and well-being into what we were doing that. But I wouldn't pretend it was easy or very speedy to try and engage your parent community in what you're trying to achieve. But you just need to be resilient and back on, I think is what I would say. We had to develop policies, and we had to look at how we linked all our policies so that well-being and mental health affected everything we did, and wasn't a standalone policy that we dealt with at 3:15 on a Friday afternoon. It actually influenced everything we did. We decided very early on that it would be useful to have a pastoral TA role. We had to fund that, we had to define it, we had to sort of try and work out how that collaborated with everybody in the school and how that would work. Fitting everything into a crowded curriculum, well, that was extremely difficult, but you know, not quite interesting for governors to get involved in the strategic side of that. We've done it in many ways, but you know, that will be moving on to operation. But we we've agreed values and focused on mindfulness assemblies. We've got whole school targets. We work on wellbeing and mental health through PSHE. We've developed a daily physical wellbeing session. We've got reflective practice and collaborative working across the whole school. And throughout all this, prioritising resilience is a theme that seemed to get us success in everything we did. We had to develop a strategy for not just introducing a wraparound mental health and wellbeing, but ensuring that we could maintain it over time. And I think we raised the profile through a mindfulness focus. We've resourced a reflection room and evaluation practices within class lessons. But we've also raised the profile of mental health and wellbeing with a pupil voice through the school council and through the head girl and the head boy. And it's quite interesting. I mean, one thing I would say from standing back as a governor and watching all this happening over 2 to 3 years, if you can get this right, you know, 8, 9 and 10-year-old children can be your best ambassadors for people talking about mental health and talking about well-being. So how do we monitor the effectiveness of it? Well, it's not easy, but we do get regular reports from the head teacher, the safeguarding lead, and other leads. We treat mental health and wellbeing as an integral part of what we do, but we also treat it as a separate subject, so it has its own subject leader who monitors and plans actions and evaluates and reports, just as they would do if they were the subject leader for maths or reading or English or history. And it's got its own governor who liaises with that leader. We make sure that mental health and wellbeing is included within our school improvement plan, and we've raised its importance, and with developments being monitored by governors and the senior leadership team. Mental health and wellbeing is an item on every full governing board agenda, as is an item at the end of every meeting, which asks not just how we have influenced, how we have had an impact on our children by meeting, but how we've had an impact on our children's wellbeing and mental health. I think whole school consistency and approaches are very important. We have lots of initiatives within school which we support, a school-wide resilience, a resilience ready project, buckets of kindness initiatives. But you've got to keep it moving. It doesn't stand still. I mean, I think mental health and wellbeing is something that you've got to continually be watching and continually supporting the operational staff in moving forwards. We continue to work with Compass Buzz, who provide us with feedback. They do a formal annual assessment and report to governors, which is particularly useful. Mental health and wellbeing is included in all staff performance management targets, which is an interesting way of making sure it's well embedded in your school. And I think, but one of the biggest measures we have is looking at the children and seeing happy children within a school. It's frequently commented on by a range of visitors. We've noted that our children, and I'm not saying we're alone in this, but we've noted that our children return to school after lockdown really approaches school positively and with resilience. And we do it through monitoring of attendance rates and behaviour logs, and also looking at the nice things people say about the school, not just the complaints. And I think that's a thing that not just in education but in life in general we just need to change and look at the good things that people say about us, not just the bad things that people say about us. I mean, I think we ask for a lot of feedback, which is useful, and I think the other important thing I'd say, and I know we're stuck for time, so I'll then shut up, but you know, celebrate your successes, because there's lots of successes attached to mental health and wellbeing programmes.
Thanks ever so much, John, and sorry to cut you short, but we will hand over to Ruth. I really would like to hear from everybody. So Ruth, over to you. So sorry. We will carry on, even though we're running out of time, but we will carry on and we will answer questions afterwards. So if you can stay with us, please do.
Okay, can you see my slides? Can you see my slides?
Yes, if you can just make them into PowerPoint view, that would be great.
Okay. Oh, I'm just trying to find out. Oh. I'm trying to find where the PowerPoint view is. A minute.
So just on the left, the from beginning one underneath that, that's it.
Right, okay then.
Perfect.
So I'm going to actually share a practical strategy. So today we've been looking at what schools can do to help improve the mental health and well-being of students. So what I'm going to share with you today is an actual strategy that we've used in our school to help empower the young people. And the strategy doesn't cost in terms of the governors having to bring out people from external. It's actually using the skills that's within the school. So my name's Ruth Pearson. I have a company called Listening to Your Voice, which specialises in wellbeing leadership and training, but also I'm the wellbeing lead at Atam Academy, which is an all-through school linking together primary and secondary school. So for today, the aims of the session what we're looking at is why it's important we're looking specifically at vulnerable students and what strategies can we put into place. So I worked in the education system for 25 years and I had a break out of the system about 5 years ago because my mental health and well-being wasn't looked after. And because of that, I went on a journey to find out what is it that's missing from the school curriculum to improve the mental health and well-being of students and also of staff. And in that journey, I discovered this, I call it Steps to Learn. So this is the first part of it to do with steps. And the steps is all to do with looking after your mental health and well-being. So if you think about the word steps, so if you actually put the letters STEPS, so that makes it easy for the children to actually remember what the different stages are. So they know initially that they're going to start, then the whole thing around team, who's there to support them. What do we mean by the word empowerment, having a positive mindset and success? And I'll go through in a bit more detail what this means and how you as a governor can put this into practice. Now, the heart of the word empowerment, as you can see, is the word we. And when we're thinking about we, we're thinking about inclusivity. So we're thinking about every child, every family, every school, so that everybody is part of the policy that we're looking at. That once the children can understand what these 5 areas are, then they're at a position then that we can start to use this strategy with them to help them improve their mental health and well-being. One of the things that very much we were discussing about, which is so important when we're thinking about the climate that we're living in, is to allow the students to be real with their emotions. So also as staff, that they're also real with their emotions, and as governors as well, for you to say how you're feeling. And it's important to say that neither one of these is better than the other. So you can see that, you know, feeling good, feeling bad, that you need to recognize where you are in terms of your thought patterns, in terms of are you optimistic, pessimistic, hopeful, fearful, so that you're able to be real with the emotions. So how do we go about putting this strategy into practice? So the first thing we need to do is start where we are. So we end up having surveys. So we do a student survey, we do pupil surveys, we do parent surveys, and we gather all that information together. And when we put all that information together, then we use it as part of the change team in the school to think about what are some of the specific things that we can put in place, which has come about from the results that have come through from the surveys. The next area, team, that it's important that we know that as governors that we're not working in isolation. So like outside agencies, what can we use, who can we use, what skill set do we have in the school? So one of the things that we do is we do a skills audit of staff. And by doing that skills audit of staff, we can see, well, what skills have we already got within the school, in the staff, that can help in terms of mental health and well-being. Now, as I said to you, I had a break out of teaching. And as I had that break out of teaching, I went to learn from the business world. What are they doing? What are some of the things that they're putting in place to help the well-being of their staff? And therefore, can we put some of those into place in terms of school? Now, also was one of the things we keep talking about is the fact that lots of budgets have got cut in schools. So therefore, it's important that we're able to use what we've got within the school to meet the needs of the students. So how do we empower the staff and the students? So one of the things that was talked about was this place to be and how they are offering a free mental health first aid training. So we've got some staff of our school which has signed up to that, or will be starting the mental health first aid training later on this month. But we're also aware that as well as staff having training so that they can help the students that's in their care, that we also need to empower the students so that they can talk to each other. So we're having an initiative in the school where we're training up mental health school ambassadors. Now, when we were thinking about the ambassadors, it's so easy to just have the popular students within the school, but we thought we also need to have some of the quiet students that we train up as these mental health ambassadors, so that the children in the school who are our pupil premium students, who might be our students from EAL, who might be other vulnerable groups within the school, that as part of these student ambassadors, that we represent all of these vulnerable groups within the school. As also shared today, that we have to integrate teaching, learning, wellbeing and safeguarding, and we do regular work with the students and staff about how all these three areas are interrelated. We also talk in the students in terms of mental health and wellbeing about the importance of the curriculum that we deliver, so that the curriculum meets the needs of the students, about differentiated work, about setting. So we tell the students that we use setting within the school to help meet the needs of their mental health and well-being, that certain students go out and they have work with the school counsellor, that they have work with the art therapist, that they have work with other outside agencies, because that meets their needs. So we allow in terms of the school that we don't say to students that because students are having to have additional work to support their teaching and learning or well-being, that that's going to impact the wider community. That again, it goes back to this whole idea that we talk about inclusivity and meeting the needs of the students individually as well as collectively. How do we build a positive mindset? I think it was mentioned before that we do lots of work with them around resilience building and the importance of having a growth mindset. Very much in terms of the can I and like I can. So in terms of the curriculum, we spend lots of time making sure that we build resilience into the classroom, that we go through strategies with teaching and learning that helps build resilience, that builds this whole inclusivity. So within the classroom, when we're delivering lessons, that we make sure that we target the questions to the students, so that if we know, for example, a student is just learning English, that we would allow them to learn words that surround the topic. Other students that need to be stretched, that we will give them work that's suitable for their needs. So as governors, therefore, we need to make sure that the curriculum that's being delivered in the school meets the needs of all the children, that it's differentiated, that we don't just focus on the students having the right attainment, but we don't think about the progress of all students. Also in terms of staffing, in terms of challenging schools, who do you have teaching the students who are the vulnerable children? Do we just have like the weaker teachers teaching the vulnerable children instead of having the stronger teachers, especially with lots of children needing to catch up? That's where we should be putting our stronger teachers, so that we can narrow the gap between one pupil group and another. So as governors, it's about drilling down what are we strategies that the school's putting in place so that we can make sure that all students make progress and not just the few at the top. Another strategy that we put in place is at the end of each day, when we're working with the students, we go through with them, what are they grateful for the day? There's so much negativity that's around, and this gives us an opportunity to allow the students to reflect. And then if no children, say for example a child can't come up with something that's happened good that day, then we can have a conversation with them before they go home, so we can make sure that they're in the good frame of mind, or if something's happened along the school day, that we're able to sort that out before they go home. So you can see that as governors, when we're putting this strategy into place, that it's something that's internal that we do using outside agencies to support the learning of the students. So one closing thoughts then is, how do we meet the needs of the students and how do we meet the needs of staff in terms of the area of mental health and well-being? Is that we have this, that we transform lives one at a time to bring out their greatness within. because we need to make sure that the students know that they're individual. Yes, we have strategies within the school that meets the needs of the students holistically, but we also need to make sure that we meet the needs of the students on an individual basis. So if you want to learn more about the work I'm doing, you can contact me. The slides will be available with contact details. Thank you very much.
Thanks ever so much, Ruth. Obviously, we have gone over time now. So what my plan is that I will share the questions that have come through with our speakers and then collate any responses that we have, and we will share it when we share the slides that we have from the speakers and some follow-up information, if that's okay, because we are at 1:10 now. We have still got lots of people online, over 300, so thank you much to everybody for joining us. It has been really, really interesting to hear everybody's viewpoints. Thank you again to all of our panelists. It was great to hear from you and really appreciate your input into our Wellbeing Governors campaign. So thank you ever so much, everybody, for joining us and enjoy the rest of your day. Bye-bye.
Bye.